During the pandemic, we got used to taking COVID-19 tests at home. Well, now the popularity of home testing for other conditions is on the rise.
Whether you buy them from a pharmacy or online, there are some important things to know about home medical tests. Dr. Frank McGeorge is here with some important things to know about doing it yourself, Doc.
That's for sure, Kim and Devin. So a new University of Michigan poll in partnership with the AARP finds across the country, half of adults aged 50 to 80 have bought at-home medical tests, with 82% saying they would be interested in taking one in the future. But they are not a substitute for your doctor.
Those tests can often uncover a condition or a risk for a condition that's important to discuss with your healthcare provider so that you can put together a plan for how that situation can be addressed.
Dr. Jeff Colgren is a primary care physician and healthcare researcher at Michigan Medicine.
And if that test uncovers a result that needs to be followed up on with a treatment or some additional testing, that your healthcare provider knows about that.
Yet, his research found only 55% of people who took an at-home test actually shared the results with their healthcare provider.
These include things like screening tests for cancers, tests for infections other than COVID-19, for example, HIV or urinary tract infection, tests for hormone levels, tests for food sensitivities. Just the availability of at-home medical tests has exploded in recent years.
Dr. Colgren also points out not all tests have gone through thorough regulatory approval.
It's really important to pay close attention to this because tests that are regulated by the federal government may be more likely to give you accurate results. To pay close attention to this information to ensure you get the most valid and reliable results possible.
Also, it's critical to carefully read and follow the instructions.
If the instructions are not followed closely, those tests can yield inaccurate results.
Now, as we saw when we did our story on at-home COVID tests, the instructions for home tests are often not very intuitive, and you really need to do a dry run with the instructions before you do the actual test so you don't make a mistake that's going to basically ruin
I have
results.
so much anxiety when I do a COVID test. I'm like, 1, 2, 3.
Exactly.
I'm nervous.
But there's other people who just kind of,
Yeah, there's so many
it.
variations, yeah. Well, if somebody does an at-home test and it shows that they don't have whatever they were testing for, do you think it's still important to talk to their doctor about it, tell them?
Well, I think it kind of depends on what they were doing the test for to begin with. So, for example, if they were looking for a urinary infection because of symptoms, I would say you should still talk to your doctor even if the test was negative, because they may need to consider other causes for the symptoms.
Yeah.
But if it's just a look and see for curiosity, it may not be that important.
It's really convenient, but you have to assume that the protocols, just like you were pointing out, vary from household to household, and there's going to be more false negatives, false positives.
And they are not dummy-proof, I would say that.
Yeah. All right, Doc.
Everybody thinks they're a doctor. Google doctors.
Of course.
People think they're meteorologists, too.
His favorite colleague, Dr. Google.
Dr. Google.
I know.